Hello, my name is Dr Saquib. I am the burn director at UMC Alliance Burn Care Center. Welcome to Las Vegas. Today, I'd like to take the opportunity to show you around our burn center. So our burn center has been in existence since 1969. At that time, when we were open, we had 6 beds, and we were the 24th burn center in the United States. Since then, we have expanded. Most recently in 2007, we've expanded to 16 burn beds. All of them are capable of providing ICU level of care. Here is one representative sample. As you can see, the bed, the monitor, bathroom, faucet here. And we have 15 more of these beds here in the inpatient ward, all dedicated to the care of burn patients. There are 128 burn centers in the United States, and only a little over half of them meet the rigorous verification standards set forth by the American Burn Association. UMC's Alliance Burn Care Center is an American Burn Associated verified burn center, the only verified burn center in the state of Nevada. We take care of not just patients in the state of Nevada, but also California, Arizona, and Utah.
I mean, it's never happened to me, but I'm actually really grateful that I had a place that I know I can depend on and say, you know what, go there. Because I know they're going to take care of me, and I know they were going to do a good job. And actually, they exceeded my expectations to the care that they gave me and everything.
In 2017, we treated over 300 patients, and of those, almost a third were pediatric patients. We took care of patients of various ranges, to ones as little as 1% to those as high as 90%. Our average length of stay was a little less than 2 weeks, and our survival rate was north of 96%. We took care of a variety of patients, from your flame burns to your skull burns and your thermal burns to those patients with electrical injuries.
The thing I like is that every time they clean me up, every time they're, like scrubbing it, they're doing it like to what I can tolerate. They're always asking me, is it too rough? Are you okay? Like, do you need anything? Is it tolerable? Do you need more pain meds or anything like that? So they're always like asking me how I feel. So that's something that I really appreciate. I really like that.
And we provide a variety of services to our patient population, from the inpatient and outpatient wound and burn care to community outreach and prevention services. We also run a variety of specialty clinics, from burns to acute and chronic wounds to the patients that need special plastic surgery attention. We have a variety of education that we employ in our community, from educating our providers on advanced burn life support to having a burn camp for our pediatric patients to having youth fire setter intervention classes as well. And we also offer a litany of wound and burn care lectures for our healthcare professionals who are not necessarily in the burn community. So right now we're going to show you one of our 2 shower rooms that we use to provide wound care for many of our burn patients. So this is one of our shower rooms. Typically we'll bring the patient on a bed here and then transport them onto this table. And you can see hoses here from the ceiling that we can attach. We also put them on a monitor if they're more critically ill, just to make sure that their hemodynamics, their heart rate, their blood pressure, their oxygen saturations are holding. So that if there's an issue, that we can abort and bring them back to their ICU bed for ongoing care. I'm standing at our outpatient burn clinic right across the hall from our burn center. We have 9 patient rooms here. We treat over 1,000 patients a year, and about a third of those are children. We here at UMC believe that the family room is essential for the patient's loved ones, because it's not just the patient that's going through hardship, it's also the family. And having family members here gives them an opportunity to unwind, decompress, clear their thoughts. And by allowing the families to have that venue, we feel that will re-energize them and refresh them to the point that they can go back to the room and be at their loved one's side, so that they can be part of the healing process for our patients. So every year, our burn center provides an open house for our community. This is an opportunity for us to raise awareness about our burn center's unique services.